To begin the treatment, place quite a bit of cream down on the foot because the cups are hard to stick in this area, and do a little bit of effleurage to warm up the tissue. Start off by placing one cup on the heel and one on the ball of the foot. These are two common areas where a lot of tension in the feet are held. Then we're going to start out with a positional release technique, which is really good for decompressing the tissue. So you're creating tissue decompression with the cups, and then you're shortening the foot. And this movement towards shortening relaxes the aberrant reflexes that produce muscle spasm and tension. Then you could do some passive range of motion where you take the toes and bring the foot into plantar flexion. And this is good as an assessment tool to see how a client is moving within a joint range. And it also improves circulation and increases flexibility. You can get them to do it 3 to 5 times after you've done it 3 to 5 times. And just make sure they curl their toes for maximum stretch. Then place the foot down, press the valves, and remove the cups from the feet. Reattach a cup to the heel of the foot and then work in strips down to the ball of the foot. That way you're getting a nice overall effect for the plantar surface of the foot. Now, a lot of foot pain is caused by degradation to the plantar aponeurosis, which can be caused by body weight or vertical ground forces. And a lot of times what happens is because we're increasing the compressive forces on the area through prolonged standing, walking, it's causing micro damage to the collagenous structures. So what we're doing with cupping is we're doing tissue decompression, we're allowing for an enhancement of circulation, we're causing vasodilation, which is going to help to improve repair and allow for a little bit faster muscle recovery to the muscles of the plantar surface of the foot. You'll find with the foot that sometimes you have to place the cup down, work in a strip, take it off, and then reattach it and work again. And you want to make sure you work vertically and also horizontally. So you can go back and forth on the foot, just working all of that plantar fascia with tissue decompression and vasodilation to the area. And make sure you get the entirety of the foot. Now place a bit of oil on the calves and do a little bit of effleurage. And now we're going to do some cupping on this area of the leg, which is going to help with any issues of the foot. Now place cups along the entirety of the calf muscles. So we're looking at the gastrocnemius and soleus here. Stretching focused on these muscles is effective because it increases the Achilles tendon's flexibility, which in turn reduces the tensile forces applied to the plantar surface of the foot. There can also be a lot of trigger points that refer from the calves down into the base of the foot. Allow the cups to be static for 2 to 3 minutes. Do some effleurage on the other leg. And then after you've done a little bit of effleurage and the cups have been sitting there statically, decompressing the tissue, increasing flexibility in areas where there's myofascial and tissue restrictions, then you can take the leg, do some passive and active movement, creating some stretch and flexibility after the tissue's been decompressed. And that's going to be really good for increasing flexibility at the Achilles tendon and throughout the entire kinetic chain of the leg and foot. Press the valves, remove the cups, then we're going to do dynamic cupping. Now place a cup down at the top of the calf muscle. This is probably the most common area of trigger points that you're going to see. And I like to do a little bit of slight myofascial glide here. This is going to be good for increasing the flexibility of the tissue there and also bringing fresh oxygen and nutrients to the surface and hopefully decreasing that myofascial pain. Then you can reapply the cup and do some more movement cupping up the middle in between the gastrocnemius muscles and just working around the calf in a lot of different directions, just looking to increase circulation and just work on decompressing usually what's going to be a tight muscle, especially if you have plantar fasciitis or any type of foot or ankle pain. Reapply the cup near the Achilles tendon, and it's really nice to decompress the tissue around the Achilles tendon there. And I like to provide a little bit of movement with plantar and dorsiflexion as I'm decompressing the tissue around the Achilles tendon. Then you can go grab another cup. I like to use a smaller cup sometimes on the Achilles just to get a little more specific on that area. And then just glide down, just up and down. Pretty simple. I like to do this for maybe 2 to 3 minutes, and it's a good way to work on the calf, but not make it too sore, because if you do a lot of excessive cupping, sometimes it can make the muscle a little bit sore afterwards. So here I'm providing a little bit of movement as I glide on the entirety of the muscle. I also like to work on the side, so I'll work on the medial aspect of the muscle. So you want to make sure that you're decompressing and relaxing the tissue around the entirety of the calf muscles, which is just going to give you a better overall effect. It's going to increase range of motion in the area, especially if that's what you're trying to do. Place it on the lateral side, and then just give it 1 or 2 pumps when you're doing dynamic movement cupping. You remember that you don't want to do too many pumps because it'll make it harder for the cup to glide. So move up and just go up and down, maybe do that 3 to 5 times. And as you guys can see, I'm getting along the entirety of that lateral portion of the leg. And then I'll remove the cups and do a little bit of effleurage to finish the treatment, just to make sure that you're increasing the circulation and doing some lymphatic drainage. Then I'll do a little bit of effleurage on the foot that we just worked on, and then go up the entire leg to finish the treatment.